Welcome everyone to week 5. Last week we looked at preparing the community through education to deal with potential hazards. But since emergency personnel and the community itself also needs to practice reacting appropriately to a hazard, this week we're going to study training exercises. Now, training exercises have several purposes. One of them is public education and one is public assurance. But the main goal of training exercises is to serve as a forum to test system readiness. They can be extremely important, especially in locations where hazards are a likely event or where hazards can have extremely serious consequences. I lived in a town when my sons were in college out west near a major fault line depicted here, where the local government was very focused on seismic preparedness, and with very good reason if you look at the statistics shown here. 75% of the state's 2 million people live within 15 miles of a major fault. So that's a lot of lives at stake. Twice a year in my town and in most of the towns in the area, they simulated a seismic event, and the town tested its readiness. They set up shelters, they timed and planned detour routes to the hospitals, they created emergency satellite hospitals, they knocked door to door, and during these events they also held fairs to teach the community how and when to evacuate, shelter in place, care for their neighbors, deal with gas leaks, create 24-hour kits, etc. So the goal was to provide some public assurance, but also to be sure that if the worst should occur, they indeed were ready. So this week we're going to look at training exercises such as this one, and we're going to learn how to construct one. Because as a public health professional, you actually may have a role in developing the public health component of a training exercise, and you will certainly have a role in the event of an actual hazard in following one. So what are the types of training exercises? Well, there are 3 main types of training exercises that you're going to study in your readings, and there are other variations of these, but these are the 3 main ones: tabletop exercises, functional exercises, and full-scale exercises. Now, a tabletop exercise is basically a simulated scenario that's discussed in an informal setting. So the participants assess plans, policies, and procedures. A functional exercise takes things one step further and focuses on coordination, command, and control between various agencies. And then finally, there are full-scale exercises, which sometimes are multi-agency, frequently so, and these involve boots on the ground. So, for example, firefighters might be decontaminating mock victims. So this week you're going to practice developing a tabletop exercise relating to the hazard that you selected for further study last week and developed that community education flyer for. So what should one consider in developing an exercise? Well, first of all, be sure to consider the key players. There's an exercise facilitator who presents the scenario and guides the group in the discussion. There are exercise players from the staff or community members who participate in the scenario discussion. And there's an evaluator who observes and looks for problem areas as the exercise progresses. You also need to determine the exercise objectives. Do you have major or minor goals? What is it you're trying to improve upon or address through this training? Then you have to examine the scope of the exercise. Is it going to focus on one specific problem or several simultaneous problems? And will it focus on logistics, coordination, communication, or all 3? Remember, too, to keep the length of the exercise to 1 to 3 hours to prevent participant fatigue. Then you have to develop the emergency scenario that the exercise is going to use for this discussion. And you also need to develop, if you're the facilitator, the interjects that are provided along the way. These are problem statements that help the exercise and scenario to evolve. Then the exercise needs materials. At the start of the exercise, the participants usually receive a manual describing the scope and the objectives and the scenario and the schedule. Then the exercise is conducted and finally evaluated. And the evaluation can include a formal after-action report on the exercise itself, but sometimes the players themselves also do a hot wash at the end of the exercise to discuss what went well and what areas were problematic. So this week, you are going to be developing this type of an exercise and look at the public health emergency toolkit that I provided you that gives you guidelines and templates for doing so. And also take a look at the example that I included in the assignment instructions and the tips. So that's all for this week. Best wishes everyone for a great week, and be sure to email if you have any questions whatsoever.